Dr. Bove, we're so delighted you're visiting us as the president of the American College of Cardiology in Riyadh, Saudi Arabia, during the 21st scientific session of the Saudi Heart. I'd like to know what's your impression first about the meeting, and how do you foresee the relation between the American College, Saudi Heart, as institutional relation and as with the country?
Well, let me first thank you for the invitation to come. As you know, there are a number of us from the American College of Cardiology having an opportunity to participate in the meeting. And the one thing we realize in terms of collaboration is that we all have common medical problems. We have acute coronary syndrome problems. We have problems in prevention of cardiovascular disease in the population, a lot of congenital heart disease related things. So I think from the standpoint of common medical problems, we have all reasons to collaborate. I think the other thing, of course, is that as we develop an international relationship and develop understanding of different diseases internationally, that we do need to collaborate more. So our college is interested in collaborating with the Saudi Heart Association in terms of having a joint symposium here at Riyadh, which is what we're doing, and then inviting you to come to our national meeting and have a joint symposium in the United States so that we can inform the physicians in the United States about issues that go on in Saudi Arabia. Because again, they're very common issues. I think the more we learn about each other, the more we'll be able to deal with some of these things.
I'm so delighted to hear that. In terms of the actual collaboration, you think registries would be an area where we could share some information?
Well, I think there's a number of things that are evolving over time that we can help develop together. And important, of course, is the registries. Our work on registries goes back about 20 years now. It's starting with a registry of cardiac catheterization and PCI. We have a national registry with over 7 million patients registered there, so we can get a very good look at the outcome of PCI, the indications of PCI, some of the complications, and even some of the devices and how they work. Now, being able to bring these registries to other countries, I think, is important, and I know that that in Saudi you're interested in developing these kind of registries, again, for better patient care, for a better look at what's going on in the country in terms of the care of patients with acute coronary syndrome. So collaboration in registries is one of the things we'll do. We're interested in prevention, collaboration and prevention programs, same kind of thing. So I think overall our registry programs, including the Cath PCI registry, which is a good prototype, also an outpatient ambulatory registry, which will give us a better view of how we're taking care of patients in a bigger picture. Comparing different countries, for example, will be a very important area of collaboration.
Do you think the data which comes out of this can actually help policy making or change that in the country in general?
Well, absolutely. That's the only way I think you can make good policy. I mean, we can do randomized clinical trials, but they're expensive, they take a long time. They are very selected populations in many cases, so you can't generalize the outcome of a randomized clinical trial. A registry looks at everybody in the country, so that when you go back and look at outcome data in a registry, you can in fact use those to make policy. And I think that's one of the things we're seeing in the United States. Some of our appropriate use criteria, for example, are based on registry data, and many of the things that we're doing now with regard to guidelines are coming from not only randomized clinical trials, but from registries. And I personally believe that registries are going to be more important over time, because as we develop more need for information, trying to do a randomized clinical trial for every question is going to be impossible. So the registries give us a better look at that.
Well, that's great. Thank you very much, Dr. Bove, for taking the time and to come from United States to here. Look forward for further collaboration with the Saudi Heart. Thank you very much.
Good. Thank you, and we appreciate very much the opportunity to come.